So now that the first PEP is stabilized, spleen 21 in her case, we want to leave the supplement we found that neutralized the PEP. We want to leave that on her because we don't want that PEP popping back up in the hierarchy. So now if you imagine them all in a row, we just took number 1, moved it off to the side, it's dealt with, and now number 2 has moved up to the number 1 slot. So let's go find number 2. Holding strong. So we'll go back to liver. Remember, she's green, so I'm going to keep checking liver because I have high suspicion it'll show up at some point. It's not first and it's not second as we just saw. So we'll go to heart, lungs, the hormone points, circulation, sex, kidney points. Now kidneys just showed up. When kidneys show up, one of the first things I think of is a need for minerals. It's the kidney's job to filter out the minerals, retain the minerals, and allow urea and water to pass through. So if kidneys show up, we think minerals. We also think high serotonin because that is the neurotransmitter related to the kidney points, kidney 27. And we might think metals. We might think heavy metals. Again, the kidneys are part of the major detoxification system of the body, and metals tend to irritate the kidneys. Especially metals that are having a hard time becoming water soluble so that they can be urinated out. So there's 3 big possibilities. What I like to do when I find kidney 27 is immediately jump to the eye tests. There are 8 eye tests that tell us about minerals. So we'll do those now. These are also demonstrated in a subsequent section on your DVD. So the first place we'll go is, with your eyes only, please look down and to the left. Hold strong. That's the location down and left for magnesium. Down to the right. Hold strong. Now magnesium, especially magnesium sulfate and magnesium bromide, is a very important mineral for green people, but it didn't show up in her case. So the next one I might be suspicious of, since we already found a need for adrenal support, adrenal cortical 21, the next thing I might be suspicious of is potassium. And we'll see if that shows up, and if it does, I'll explain why. Looking up and to the left. Hold strong. That's sodium. Up and to the right. Way up there. Hold strong. And it actually is potassium in this case. Potassium is up and to the right. Potassium seems to be the major mineral that gets depleted the fastest when the body needs cortisol, when the adrenals have been working very hard. You start to see these patterns unfold when we get to triple warmer 23, which hasn't shown up yet either in her case, which is interesting. But is almost certainly in our hierarchy here, since we found 2 things directly helping adrenals. When people get panic attacks, they need potassium. When blood pressure elevates, they need potassium. When cortisol gets low, people need potassium. If they sweat a lot with their hands, people need potassium. These are the common things. They're all related to sympathetic overload. The adrenaline fight or flight response. And potassium seems to be one of those wonderful minerals that modulates that response. So let's find out what kind of potassium could be good. Now it has to do a couple things for us. It has to balance the points K27 if it's the one we want, because that's the PEP we're on right now. It has to fix our eye position, and it has to do both of those while under stress. Thankfully, there are all sorts of potassiums out there, but thankfully, good old potassium citrate seems to do a good job for most people. Eyes up and to the right, please. Hold strong. That looks good. You can look normal. And then back to K27. Looks good. But we don't give anything unless we pass the stress test. Holding strong. So how is K27? And eyes up and to the right. Hold strong. Fantastic. So what we already know, if we just fixed K27, it passed the stress test and so forth, we know, if I take potassium off, that it probably wasn't a serotonin problem. Remember, high serotonin is what we find when we see migraine patterns. But just to be thorough, let's go back and throw serotonin on and see if it weakens her, and it doesn't. So serotonin is okay. And this patient has never complained or had a history of migraines, so that's another indicator. But if they ever do, the first thing you would check when you touch kidney points, kidney 27, is serotonin. Because almost certainly it's going to be high. And when we get examples of that throughout this DVD, I'll show you how we break that down. And it's also laid out in the book, Hope for Health.